Every person is deserving of health care. That's something that I fundamentally believe and we believe at Unbossed. But no person should have to drown in medical debt in order to receive it. Look at this headline. Progressive senators sound alarm over rise of predatory medical credit cards. What a dystopian phrase, medical credit cards. Several senators are warning that medical credit cards are looking to profit off of patients. Here's a list of senators who wrote to Wells Fargo and Synchrony Financial: Elizabeth Warren, Ed Markey, Bernie Sanders, Chris Murphy, and Sherrod Brown. The letter goes on to state the following. The concern here is the current structure of our healthcare system often requires that patients enter into medical debt in order to access services they need. Within that context, patients, often under duress because of concerns about their medical care, are being pushed into and then locked into medical credit cards despite the availability of alternative payment options that might be more beneficial and offer lower interest rates. Given the circumstances in which these credit cards are used, medical credit cards could be predatory to patients seeking medical care and leave patients stuck paying higher costs with hefty high interest debt. Now in the United States, we're already paying more than other nations for our healthcare. More than 100 million people are saddled with medical debt in the United States, collectively owing upwards of $200 billion. So the issue with medical credit cards, I think you can anticipate the reason that so many people are predatorily roped into taking on medical credit cards rather than paying off their debts in other ways. Banks have identified medical credit cards as a lucrative opportunity to profit off of the worsening crisis of patients who are unable to afford their medical care. So this isn't a new problem, it's just a growing problem. Reporting from Common Dreams, back in 2013, the Consumer Financial Protection Bureau, or CFPB, ordered Care Credit, Synchrony Financial's medical credit business, to refund up to $34.1 million to consumers who were victims of deceptive credit card enrollment tactics. And recently, last month, CFPB hit Wells Fargo, which offers a medical credit card named Health Advantage, with $3.7 billion in penalties for a slew of abuses, and called the institution one of the most problematic repeat offenders of the banks and credit unions. So as a reminder, those figures of how many millions people are in debt, it's 1 in 10 adults, look at this headline, who owe medical debt, with millions owing more than $10,000. So not only is healthcare outrageously expensive and health insurance terrible and difficult to come by in the United States, oftentimes when you have it, you still have your claims denied by your insurance. So this is not just a crisis of people being uninsured. This is a crisis of people who are supposed to make people who are sick or dying better, instead using their job and the service they provide, whether it's a hospital or otherwise, to make a lot of money, to get richer at the expense of literal human lives. And someone could be saddled with debt because they had a life-saving procedure. Jackson, what are your thoughts?
Well, I mean, just the whole concept of medical credit cards is just steeped in the idea of profit. And it shows that profit is at the center of our healthcare system in the first place. And unfortunately, think about the ROI on this. If you have a lot of capital and resources like these banks do, or any type of private investor who gets in on this, you're going to make a lot of money off of it because so many people don't have health insurance. So in terms of profitability, it's incredibly lucrative if you're somebody who already has liquidity. And, just our whole healthcare system, we all know it's a mess. But I mean, just think about how every year, if you don't have healthcare through maybe a company that you work for or something, or if you're not on Medicaid or Medicare, you have to re-sign up every single year. And every year, the prices may be a little different and the packages are somewhat different. A lot of people end up not having health insurance because the process is too complicated and annoying, and people may figure, I'm young and healthy, so who cares? So the whole system is just a joke. It's like numbers. It's like the lottery. People are just running and getting into it and trying to get a profit like it's sports gambling or something.
Yeah, it reminds me of the debates we had in 2020 during the Democratic primary when we were talking about the issue of healthcare in the United States. And you had so many people like Pete Buttigieg, even Elizabeth Warren, who had a plan for universal health care and then rolled it back. And then you have people like Pete Buttigieg, who the whole time was saying people should have access to health care. If that's how you feel about healthcare in the United States, it is because you've never had to struggle to access healthcare. Access is not a word that fits in that sentence. You need to guarantee healthcare. You could say, yeah, I have access to purchasing Twitter. I don't have billions of dollars. It's an illusion to say that anybody could get healthcare in the United States if they want to, when we have a minimum wage of $7.25 an hour. It's impossible for people to purchase healthcare in the private market. And these businesses are not offering healthcare to their wage employees. So it's just insane that the people that are tasked with representing the public have no idea clearly what everyday life is like for the public. If you've never had to live paycheck to paycheck, if you've never had to be uninsured and go through a sickness and take on medical debt, these people don't understand fundamentally what the American life is like for the people that they're supposed to represent in a democracy. And this is the crisis with oligarchy. It's not just that the rich people are using their power to accumulate more wealth and become more rich, but they have no idea how to govern for everybody else who lives in the country. And that's really the reality of the United States of America. And that's why we have these big banks saying, hey, I've got the solution. Put them in debt for the rest of their lives. Jackson?
Yeah, I think you nailed it. Access is such a loaded and vague term. We all have access to many things, but that doesn't mean that we're actually going to obtain them. So, I think you closed it out perfectly. And unfortunately, it's going to be a long, continued fight to fix our healthcare system. But the fight is worth it, and the fight is one that we're not going to give up on.